I'm Scarlett Aldrich. I'm a plastic surgeon at LMH Health. For as long as I can remember, I've wanted to be a surgeon, which is kind of strange. I think people usually get to that decision once they're in medical school, but for as long as I can remember, I've enjoyed anatomy. I've enjoyed kind of figuring out how things work. I enjoy the opportunity to help people. You know, there are very few fields, I feel like, where you can work so intimately with people, that you can really share some of their dark times, but some of their happiest times too. And being able to walk someone through that is really gratifying. I'm very family-centered. Family has always been really important to me. I've spent my whole life in this area. I was born and raised in the Kansas City area. I went to KU to stay close to family, and I continued the rest of my training through KU. It's been an excellent training program, but it was also really nice to stay close to family. It's a really strong support for me, and I enjoy that. That also comes into play whenever I'm dealing with my patients to help them get support that they need as well during their times of healing. I have a daughter. She's awesome. One of the most gratifying things in my life has been becoming a mom. It's always a balance, being a surgeon and being a mom, and there are many people who thought that that would be challenging, but it's the most worthwhile challenge of my life. It's been pretty awesome. I think some of the best advice that I can give to patients is to just say it. Sometimes I think that we are so concerned with how it's going to appear or what people are going to think of us if we think or feel a certain way. But it's important as their physician that I know where they're at, not just from a surgical standpoint, but where they are emotionally, where they are with their social situation, how their family support is. And if they can just say that, just give me that information. If I can provide an environment that allows them to be open with all of those things, then I can treat them as a whole person, not just one tiny aspect of their surgical care. I think the most important thing is being honest and being straightforward. There are a lot of times when the truth is difficult to hear, but I think it's important to be honest, to be direct, to be transparent with patients, because I think that's how you can build trust. And if a patient can trust you, then you can work in some of the most intimate aspects of their life. There's nothing more scary, I think, than putting your health and your life in someone else's hands. But if you can trust that person, then I think that's a little bit easier to do. And that's the kind of physician that I am. I want to walk someone through the entire process. I want them to be able to come to me with any questions, any concerns, whether it be the happiest day of their life or one of the darkest. I'm going to be there to support them through that.